Okay, so this is my kitchen for my physical assessment. This is my daughter that's going to be my patient. My bed, or my table that is my bed, my supplies. Then my kitchen. My daughter that's going to help record. My living room with my son's toys, and hopefully he'll stay in there and be quiet while we do this. This is my name tag for NKU. And this is my name tag, the one that I have on. And this is for where I work at. And then refrigerator wise, the things that are on here is just from the kids' school. And that is it. Like their graduation, pictures, that kind of thing. Graduation, pictures, school events that were supposed to take place. And that's that.
Oh.
All right, so knock knock.
Come in.
I'm gonna wash my hands. And then can you tell me your name?
Tori.
And Tori, do you know my name?
Monica.
And can you tell me what we're doing tonight?
A physical assessment.
And can you tell me who the president is?
Trump.
And can you tell me what year it is?
2020.
Okay. All right, that's awesome. So to look at Tori, we're going to go through with her skin, and we are going to look at her general skin as we do each assessment. And then when it comes to looking at her appearance, she looks very well kept, and we don't have any, there's nothing wrong with the way that she looks. We did weigh Tori prior to, and she weighed 115. And how tall are you, Tori?
5'9".
And so she's just a smidge on the underweight category within her BMI. Now what we're going to do is we're going to grab her vital signs really quick. And we're going to do her blood pressure, her heart rate, we're going to check her temperature, and her pulse. Maybe rest your arm down. Tori's blood pressure is 108/71. Do your pulse just for a moment. Her heart rate is 61. Okay, so Tori, what we're going to do next is we're going to walk down Tori's respiratory rate, also is 16. We're going to walk down to the tape, and we're going to look at the Snellen chart. This will be cranial nerve number 2 as well. So what I want you to do is cover your left eye. And I want you to tell me as far down as you think you can read, and I want you to tell me the number that you feel like you can read.
7.
Okay, go ahead and let's start with 8. Let's see if we can do 8.
D, E, F, P, O, T, F, O.
Okay, Tori missed 2, the last 2 on there, but we're going to count that okay, is in her right eye, so we're going to say that she can see 20/20. Another thing, Tori, is do you wear contact lenses or eyeglasses?
Yes.
Which one?
Both.
You wear both. Okay, do you have your contacts in right now since you have glasses on?
Yes.
Okay, so let's go ahead and let's cover up your right eye, and how far down do you feel like you can go with your left?
To 8.
To 8?
Yes.
Okay, let's go ahead and try that.
DEFPOTEC.
Okay. Okay, let's try to go down to 9.
CEFLEF.
Okay. All right, so we're going to go ahead and go back up to 8 here. So we're going to say that Tori has 20/20 when it comes to that with her glasses in. Or I'm sorry, with her contacts in. So we'll come on over here. Okay. All right, so we're going to start with Tori's head, and we're going to inspect around her hair. Tori took down her hair for us so we could be able to see. So we're going to look around her hair and check her scalp and see if we see any kind of abnormalities. Okay, I don't see anything. And then we're going to go through here and we're going to palpate. We'll see if we feel any kind of masses or any kind of bumps, anything that we shouldn't have there. And there is nothing at all that I feel this abnormal. Just to look at Tori's face, her eyebrows are symmetric, her eyes are symmetric. Her face looks completely symmetric. There's nothing that looks like it's off on one side or the other. When it comes to her ears, the pinnas are even with the corners of her eyes. I do note that Tori has 2 pairs of earrings in, and when it comes to her face, she pretty well has a clear appearance. She does have some freckles and maybe just like a little bit of acne that's on the sides. Besides that, I really don't see anything different. So let's go ahead and we're going to start with Tori's ears. So we're going to inspect her ears. We're going to go around on both sides, and we're going to feel and see if we feel or see anything. And I do not feel or see anything on her left ear. We're going to go around and we're going to feel and see if we see anything on her right ear. And I do not feel or see anything in there. We're going to go through with the otoscope here, and we're going to go ahead and look in her ears and see what you can see. We should see her tympanic membrane. Okay. And then we'll over here, and it's nice and gray, kind of like a shell color, not red, not bulging, nothing of that nature. And then we're going to go over here, and we're going to look in this ear. Go ahead and bend down toward me a little. She does have some extra wax built up in here, but her tympanic membrane looks nice and intact, and it looks gray, and it's not bulging. For a child's ear, you would pull down and back. For an adult ear, you would pull up and back. And then we're going to do the whisper test. So, baseball. And then over here, we're going to say strawberries. Okay, good job. For cranial nerve number 5, we're going to go through and I'm going to feel Tori's TMJ. And what I want her to do is open up her mouth. And here you go. And then close. And then we're going to go ahead, and I don't feel anything that's abnormal here. We're going to go ahead with a cotton ball as well. And I want Tori to close her eyes. And for sensitivity, I want to like touch her and her tell me where she feels the cotton ball.
No. 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 No.
Okay, good job. Okay, all right. So that is Tori's ears and cranial nerve number 5. So next we're going to look at Tori's eyes. We already did a Stellan chart, which is cranial nerve number 2. Can you close your eyes for me a second? Do you smell anything?
Mm-hmm.
What do you smell?
Vanilla.
Vanilla. Okay, so so her cranial nerve number 1 is intact. And then we're going to go through and we're going to look at Tori's eyes. So we had already said earlier that they look normal when it comes to appearance. We're going to look at her sclera and her conjunctiva. Her conjunctiva is nice and pink, and her scleras are good and white. We're going to go ahead and feel her sinuses while we're here. Do you feel any kind of discomfort?
No.
Feel any kind of discomfort?
No.
Okay. And then when we actually look in her eyes, we're going to look to see her, to look for the red reflex, and then we're going to look for her optic disc. So go ahead and look at me. So go ahead and open up your eyes. I see the red reflex here. And I see the red reflex there. Okay, I'm going to go in and look at her optic disc. I'm going to raise it up here just a second. I see her optic disc. Go ahead and open up your eye. Look at me. Okay, be able to look at Tori's eyes. Okay. All right, next what we're going to do is we're going to look at Tori's nose. Tori's nose looks normal. It doesn't look like there's any kind of abnormalities. We're going to palpate. Do you have any kind of soreness, any kind of issues with your nose? No kind of issues there. We're going to use our light. We're going to look up in her nose and make sure everything is the way that it should be. No polyps or anything. I don't see anything different. I don't see any bleeding. I don't see any kind of lesions or anything up in there. So what I would like for you to do next is I want you to hold one side of your nose, and I want you to breathe on the other side. And I want you to do the same thing to the opposite side. Do you have any issues with breathing on either side?
Yeah.
So she has nasal patency on both sides. So next what I would like for you to do is we're going to look at Tori's mouth. Her lips don't look cracked. She doesn't look like her mouth is dry. We're going to have her open up her mouth. And I'm going to use my light just in case I can't see with this one. We're going to look at her, the inside of her cheeks to make sure that they're pink and they're moist. Her buccal mucosa, we're going to look in there, and I don't see any kind of issues. We're going to look at her tongue, and I don't see any problems with her tongue. It's nice and dry, or it's nice and moist. It's pink. Go ahead and raise up your tongue so we can look underneath it. It looks good. I don't see any problems there. Now put your tongue back down. Let me look at your teeth. I don't see any kind of cavities or dark areas or anything abnormal. Can you raise up your tongue one more time? Okay, we're going to go back around to your teeth. Good job. And I'm going to have you say ah.
Ah.
Her uvula raises and her soft palate raises as well, which is cranial nerves 9 and 10. And she is also sticking out her tongue, which is cranial nerve number 12. Cranial nerve number 11 would be for her to shrug her shoulders. So we're going to go ahead and push down. And we're going to have her raise them back up, and there's no problems with that. We're going to go through and check for her lymph nodes and make sure that we don't feel anything. Lymph nodes, we shouldn't feel anything. If we did, it could be like a sign of infection. But generally, you should not be able to feel her lymph nodes at all. Let me check back here. Make sure it's everywhere. And then her trachea, her thyroid. And then we're going to listen to her carotids. We're going to listen for any kind of bruit. So we'll go ahead and listen. I'll have you hold your breath for a second. Okay. I'm going to listen over here. And have you hold your breath for a second. Okay. I don't hear any differences. Okay. Okay, so we're going to go back through and we are going to check her temperature really quick. And okay, she's 98.2. we are going to check her 6 cardinal signs of gaze, which is also 2, 4, and 6, or 2, 5, and 6, 2, 4, and 6, 3, 4, and 6. I'm sorry. So cranial nerves 3, 5, and 6. 3, 4, and 6. Okay. So sorry. Okay. Let's go ahead. I want to look at your pupils. Okay. So here we go. Make sure that your pupils are reacting. Look at me. Good job. Make sure your pupils are reacting. Good job. All right, and then let's do your 6 cardinal signs of gaze. So I want you to look at my pen. Go up. Make sure that we are have a nice, smooth view and then accommodation. Good job. And then we're going to go ahead and do her Weber and Wren test. Do you hear it on both sides? Equally? Okay. And then we're going to check her bone to air conduction. Which one do you hear the most? Air. Okay. And then we're going to do the other side. Air. Okay. Okay. So we're going to do her deep tendon reflexes. Excuse me. We're going to do her deep tendon reflexes, and then we're going to do her range of motion really quick. So I'm going to go ahead and have you raise your arm up here if you don't mind. And I want you to have it dangle and try not to tighten it up. Okay. And we're going to do this on both sides. Here. Okay, good job. And I'm going to go down here. Yeah, have your arm relax. Good. Good job. And I'm going to do right down here. Your wrist. And then we're going to do your patella. Okay. There we go. And then okay. Let's go ahead and do your ankle. So we're going to do your Achilles. So I'm going to hold your foot up. I'm going to touch the back of your foot, okay? Okay. Her foot went down. Spread your legs for me a little bit. See your leg back there. There we go. And then her foot went down. All right. And then we're going to do cranial nerve number 7 really quick. So I want you to smile, frown, raise your eyebrows, and then I want you to squint really, really tight. And then we're going to go through and we're going to do sharp and dull. So I want you to tell me if it's sharp or dull.
Soft. Sharp. Soft. Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. 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 Sharp. Soft. Soft.
Good job. Okay. All right. So then we're going to go through and we're going to do range of motion really quick. So I want you to raise your shoulders. Put it back down. I want you to raise your arms up like this. Pull towards you. Good job. And then I want you to put your arms down like this. Okay. And then I want you to turn your wrist over. Put your wrist down. Put your wrist up. Up. Layer. Back together. Down. Put your fingers down. Raise your fingers up. I want you to turn over. Cup your fingers. I'm going to turn and see strength there. And then I want you to go ahead and put your arms down for me. And then I want you to stand up for me if you can. I want you to put your hands on your hips. I want you to go side to side. And then I want you to be able to twist your hips without moving your hips. Twist your body without moving your hips. Good job. And then I want you to hold onto the table. Put your leg out. And I want you to put your leg back. Good job. All right. Let's turn back around. Let's go back to your arms. I want you to go up over your head. And then I want you to go back down. I want you to go forward and back up. And I want you to go back down and all the way back behind you. Good job. And then what I would like for you to do now is to go ahead and get back in bed. And I want you to go ahead and lay down. Okay, so what we're going to do now is I want you to take this leg, take this leg, put it out, put it in, raise it up, put it down. I want you to go in, I want you to open, go back, and then put it back down. Good job. This leg, I want you to go out and in, up, down, go back in. I want you to open, go back in that way. Okay, come back down. Good job. I want you to push toward my hand. Go back in. I want you to come in and go back out. Good job. Do you have any issues at all with your knees with cheerleading? No. Any issues with your elbows or anything? Okay. And then with your feet, I want you to push down. I want you to raise up. Okay. And I want you to put your toes together. Toes together. There you go. And then toes apart. And then kind of put the heels together, or the sides together if you can. Kind of like that. Yep. Okay. All right. I think that is your range of motion. Okay. I'm going to do her JVD, and we're going to look for her JVD. So as she's laying down here, normally it would be like a 45-degree angle or so, or laying flat, and she does not have any kind of jugular vein distension at all. We're going to go down and we're going to listen to her heart sounds, and she has her her aortic, her pulmonic, her tricuspid, and her point of maximal impulse, or the mitral valve. So let's go ahead and listen to her heart. We'll move on to her abdomen. We're going to listen for vowel sounds. She has good, strong vowel sounds in all 4 quadrants. We're going to listen to her aorta, and we're going to listen to her renal arteries. Do you have any problems with your abdomen, or is your stomach sore at all? No. Okay, we're going to do light palpation because she doesn't have any kind of stomach pain at all. So we're going to go around and we're going to go really lightly. And then, do you care if we go a little deeper?
No.
Okay. So we're going to go a little bit deeper and see if she has any kind of tenderness or pain. I don't feel any difference. I feel her muscle tone. Then we're going to go up underneath her left rib here, and we're going to feel for her liver. And we can feel like the tongue of it. And then we're going to look at her legs for pulmonary vascular disease. We don't have any kind of viscosities, no issues. She has pulses on both of her feet, and so no discolorations or anything. Okay, so I want you to go ahead and sit up. We're going to go ahead and listen to your lungs. So we're going to start up here. Take a deep breath. Okay. Okay, listen over here. Good job. I'm going to have you kind of shift around a little if you can. Let's listen back here. Okay, lung sounds are nice and clear. While she's sitting here, we're going to look at her C1 through C7. Come bend your neck down if you can. So I don't see any kind of abnormalities or any kind of problems here. Now I'm going to have you stand up for a second. We're going to do a renator drift, and what I want you to do is hold your hands out like this. And we would do this for about 20 seconds, and to make sure that she can keep her balance, and her balance is fine. So you're going to put your arms down, and then I want you to take a couple steps this way, and I want you to walk back, and I want you to put heel to toe. Good job. So her balance is fine. And then we want to look at her spinal process. I want you to go ahead and bend over, we're going to make sure that her spine is good. And then also we're looking at the curvature of her back as well. And then we're going to stand back up. And I believe this concludes her assessment.